Good morning. My name is Zhipeng and I'm an assistant professor in the Department of Architecture and associate director of the Center for Health Systems and Design at Texas A&M University. Today, on behalf of my team, I'm going to introduce our research regarding virtual windows on hospital users' health and well-being. First, I want to ask you a question. How many of you work in an office without window? Many of you, right? You're not alone. Other studies showing that people in Europe, Canada, and North America spend 50 to 85% of their time in indoor environments that have limited access to daylight. A recent published survey of 3,600 office workers in 7 European countries and the UAE reported that 7% of their office workspace had no window view. And 42% had to switch on artificial lights because of insufficient daylight. This is a universal problem, right? What are the common areas without window? As mentioned, office, and then what else? Prison, right? For control and safety reasons. Hospitals with big building blocks, also without window. And submarine, very obvious, and inner city schools in some high density area have limited space and have to put some of the activity areas like gym and some classrooms to the basement. Windowless environment will cause some health concerns. Early studies show that staying in windowless room for a long period of time will develop negative feelings, including isolation, entrapment, and tense and perceived claustrophobic symptoms, and will increase the level of stress. This does not sound good for medical staff since they are already overloaded and experience high level of stress, which will lead to more cases of burnout and medical errors, not to mention patients and their family members who are stressed out by the incoming treatments or surgeries or under the conditions of recovery. There are two major theories from the field of environmental psychology that explain the benefits of exposure to nature. The first one is attention restoration theory, and the second one is the stress reduction theory. Kim and his or her colleagues identified 5 major benefits to have windows. Regulate air quality, with the assumptions that you have an operable window and the outdoor air quality is excellent. Provide nature view, provide ample daylight, and provide a connection with outside world with the information such as weather, time, sunlight, and having windows in the hallway and public area also facilitate better wayfinding. This is extremely important in healthcare facilities, where wayfinding is always difficult over there. So if there's no window, what are the potential substitutions? Different studies provided a variety of options, such as indoor plants, images of nature, artificial windows, and virtual reality, and even sounds of nature. Through the literature review, we found the application of the benefits of virtual environments are very promising. So virtual reality is likely to provide a high degree of immersion. However, its medium requires restrictive individual because you can have virtual reality goggles for everyone, right? And currently the goggle is really expensive and tends to isolate people from their physical and social environment. Once you wear the goggle, you can't interact with others. And you can't ask a nurse to wear a virtual goggle during the work, right? So we turn to the idea about the installation of artificial, say, virtual window. And we believe that a video screen with sound may be more accessible for multiple individuals, providing restorative experience and positive distractions while they simultaneously doing their work. There are limited numbers of studies examining virtual windows. The first paper we introducing comparing the artificial window with indoor plants. They found that the artificial window feels less natural and is not real because it was a still image, not video. An artificial window will create too much distraction if the participants are sitting too close to the window, and it will decrease the job performance. The other study comparing the nature video and mentalization-based treatment for individuals with substance use disorder and found that viewing nature video has similar benefits in overall mood and negative effect as the mentalization-based treatment, and therefore nature would be a cost-effective alternative treatment strategy. And this study compared the effect of a perceived live video versus recorded video. It was not a real live stream, but the participants was told it was. So the results show people watch the fake live stream video have better cognitive inhibition, meaning that people can concentrate better on what they are doing. Another study examined the effect of calm nature films on the level of anxiety, pain, and stress on patients. The researcher found that compared to the control group, the patients who watched the calm nature film experienced lower cortisol level, high level of prolactin, and higher levels of oxygen. So above were the 4 studies published after we proposed the virtual window study, but their results were very encouraging and pushed us to do a better job. Our study is to investigate the influence of virtual window views on hospital patients and caregivers' health and well-being, as I mentioned earlier. I have to confess that we have not yet started data collection due to the construction project delay with our previous collaborators in Taiwan, and then we have to switch the collaborators. We found another collaborators in China, but then the COVID hit. So we are slowly getting back on track as situations in China are getting better. This is the virtual window composed of 4 large high-definition screens. And the research was inspired by my friend Diana Anderson, who is both an architect and an MD. We will first conduct 2 experiments using skin conductance to detect participants' stress level, eye tracking device to document the area of interest, and EEG to check the brain's responses to virtual window. In the phase 2 of the study, which is the main study, we are going to compare 5 different settings with a combination of virtual window, printed image, real window, and nature sound. Then we will install the virtual window in a windowless waiting room in the hospital and document medical staff and patients' response or reactions and their behaviors in that space. We will also conduct focus groups or interviews with hospital medical staff to see how the virtual window affects their mental and psychological well-being. Our research team is very enthusiastic about this project and believe that the research results will be very informative to the healthcare design and improve the quality of the environment where you live and work. We are also very thankful for the generous funding support from the Center for Health and Nature. And thank you so much. Thank you for listening.